2018年第7條題目係有關於升糖指數。升糖指數係代表住一款食物佢對於血糖水平嘅效應。一款食物嘅升糖指數越高，當我哋進食咗佢之後呢，血糖水平嘅上升係越快嘅。咁下面呢幅圖啦，就顯示咗一個健康嘅人啦。當佢進食咗高嘅升糖指數同埋低嘅升糖指數嘅食物之後嘅3個鐘之內，究竟佢嘅血糖有啲咩嘅變化呢？先升後跌，咁佢哋升幅又有高與低嘅比較啦。咁陣間都會問你嘅。咁 Part A 呢就非常之直接啦，就要我哋去描述一下，究竟食完呢餐飯之後，無論係高嘅升糖指數啦，定係低嘅升糖指數啦，係如何去導致到血糖水平嘅上升呢？咁呢個題目啦，就係描述嘅題型啦，係唔需要解釋嘅。咁當中啦，亦都考我哋嘅概念咧，就係有關於碳水化合物嘅消化啦，同埋吸收。而最緊要嘅，我哋就要將佢扣緊翻血糖水平嘅上升啦。咁所以你都見得到呢，我哋今次睇呢幅圖就主要睇翻上升呢一部分嘅啫。咁隔離啦，呢一度呢就係兩段嘅文字，就描述翻消化同埋吸收嘅。點解我哋需要消化呢？係咪樣樣嘢食都需要消化呢？其實唔係嘅。如果嗰款嘢食本身係好大嚿、好複雜，例如澱粉質啦、大部分嘅蛋白質啦同埋脂肪啦，佢哋都係太大嚿、太複雜。而我哋嘅消化管道嘅壁呢，其實就係差異滲透，亦即係話細粒嘅、簡單嘅先能夠擴散到過到去嘅，又或者水咧就係滲透過去啦。咁當然水就唔需要消化啦。所以呢一啲複雜大嚿嘅嘢食呢，我哋就要先將佢拆解成為細粒同埋溶得到同埋簡單嘅結構，先能夠穿過到消化管道嘅壁啦，從而進入血液嘅。而呢個將嘢食拆解嘅過程，由大嚿複雜變成細粒簡單呢，就叫做消化啦。而接住第二段呢，就講啦，當一樣嘢食已經係完全被消化變成細粒啦、簡單啦同埋溶得到嘅特性底下呢，佢就能夠被吸收去到我哋嘅循環系統啦。而吸收嘅地方喺邊度啊？就喺我哋嘅回腸，而我哋就將嘢食吸收入去血液啦。而呢條題目最關鍵嘅概念呢，就係有關於碳水化合物嘅消化啦。無論你係複雜如澱粉質，就係將佢拆解成好多好多粒嘅葡萄糖啦，甚或乎係一啲雙糖啦、麥芽糖啦、蔗糖啦、乳糖啦，入面都係含有葡萄糖嘅。所以我哋就要去講解翻碳水化合物嘅消化啦。第二啦，就係吸收究竟喺邊度發生呢？我哋要明白到消化咗嘅嘢食到頭來係吸收咗入血液嘅。所以啦，我哋就要噏得出啦，消化咗含有碳水化合物嘅食物啦，就會拆解成為葡萄糖啦。而呢啲葡萄糖就會喺小腸吸收進入去血液啦。咁呢條題目仲有啲咩嘅變奏呢？佢就可以問下你啦，描述一下食完呢餐飯之後會導致到血糖水平嘅改變。咁呢條題目你見到啦，由2分變成3分，點解呢？因為多咗1分改變喺呢度。本身嘅題目呢，佢同你講血糖水平係上升，但係而家我問你改變，就即係話你要睇一睇幅圖先啦。無論係食咗高升糖指數定係低升糖指數嘅食物呢，原來血糖水平都係會上升，所以你要講第1分，血糖水平食完餐飯之後會上升，再描述下呢餐飯係點樣導致到血糖水平上升。而第二個變奏呢，同樓上呢條係一模一樣嘅答法，但係個題型係轉變咗嘅，由描述變成解釋。解釋下當食完呢餐飯之後血糖水平嘅改變，其實問緊你嘅係同一樣嘅嘢。第1分都係講個改變，血糖水平上升，而要解釋嘅就係解釋翻碳水化合物嘅消化同埋葡萄糖嘅吸收啦。好，咁跟住啦，去到 Part B 啦，我哋呢3個部分呢一齊嚟講啦。第一部分呢，就要我哋去講翻呢一款能夠降低血糖水平嘅激素究竟叫咩名呢？第二啦，就叫我哋去描述呢款激素係如何去降低血糖水平嘅。而第三呢，就要喺翻呢幅圖上面去繪畫一條曲線，去表達翻一個健康人士去進食咗一個高嘅升糖指數嘅嘢食之後呢，呢款主要激素嘅水平究竟會如何變化呢？ 咁其實 Part 1咧係非常之直白嘅啫，就要我哋去分辨翻胰島素同埋高糖素嘅功能嘅。翻題目咧，我哋都見得到噶啦。當進食咗高嘅升糖指數或者低嘅升糖指數嘅膳食之後咧，呢個人嘅血糖當初係提升，然之後係下降翻嘅。咁所以答案咧就自不然係胰島素啦，因為胰島素嘅功能咧就係將我哋嘅血糖降翻低。而第二部分咧，其實就考翻我哋啦，胰島素係如何去調節翻血糖水平呢？今次講嘅調節咧，其實就係將血糖水平下降翻去翻正常嘅血糖水平啦。咁啊，其實書本咧都已經有晒答案俾你哋噶啦，所以溫書咧真係好緊要嘅。咁特別我想提大家嘅咧就係呢一啲動詞啊，刺激啊、增加啊、促進啊，諸如此類。佢今次都係兩個都係刺激 stimulate 啦，但係佢可以係促進啦。咁促進咧有兩個字嘅，一個係 enhance， 另一個係 promote， 其實都係嗰個意思嚟嘅。咁而家血糖水平高過正常水平啊嘛，咁第一個做法啦，就係叫你嘅身體細胞啦、肝細胞啦，甚至乎肌肉細胞啦，喺個血入面咧抽取翻一啲過多嘅葡萄糖入去個細胞先。咁啊抽取咗入去，咁啊算數噶啦？唔係，因為如果啦你太多葡萄糖入咗你個身體嘅細胞入面咧，其實係會令到個身體細胞入面嘅水勢下降咗噶嘛。跟住啦，你嘅組織液嘅水分咧就會滲透入去個身體細胞，從而你嘅身體細胞就會爆咗。所以我哋唔會淨係吸收啲葡萄糖入去嘅，我哋仲要點啊？用鬼咗佢啦！用咗佢就最簡單噶啦，促進翻或者增加翻一個身體細胞嘅呼吸作用，去消耗咗啲葡萄糖佢啦。而除咗用咗佢之外，儲起佢又得唔得啊？因為糖原呢就係一款溶唔到落水嘅狀態，亦即係話佢係唔會影響到個身體細胞嘅水勢啦。咁所以呢，我哋都可以刺激或者促進翻一個葡萄糖轉化成為糖原嘅過程啦。咁啊都記1、2、3，咁啊記緊啦，就係由肝臟細胞啦，同埋肌肉細胞咧所能做出嚟嘅。而喺呢一 part 咧，我特別想提嘅就係胰島素同埋高糖素都好，佢係喺體內平衡嗰課咧，我哋學翻嚟嘅。咁當中我哋學咗咧就係負反饋嘅機制。胰島素嘅基本功能就係將個血糖降低，但係降低到去邊呢？就要翻去正常水平。高糖素啦，佢嘅基本功能咧就係將個血糖水平提升翻，但係提升唔係大晒，係提升翻去正常水平。如果到第三部分咧，我哋就要理解翻咩叫做延時效應啦。因為咧我哋學過嘅荷爾蒙嘅控制，相比起神經系統嘅控制咧，其實係慢一啲嘅。我哋啦去繪畫呢條曲線嘅時候咧，有啲嘢係要留意嘅。第一啦，你要有翻一個基礎水平先，因為啦荷爾蒙咧唔係有同冇嘅問題，係多與少嘅問題。呢個生物學嘅哲學咧，我都成日講噶啦，唔係話你個身體當血糖過高嘅時候咧，你先去釋放胰島素，而係當血糖過高嘅時候，你個身體會釋放多一啲嘅胰島素，係 more or less 嘅問題，而唔係 yes or no 嘅問題。所以啦，一定要有一個初始嘅水平啦。而第二個問題有關於延時效應嘅，你就要明白啦。當個血糖上升到最高峰，究竟我哋嘅胰島素嘅分泌係咪同一時間都係最高峰呢？我哋發現唔係嘅，當中係一個延時效應，係當血糖水平上升咗之後，我哋嘅胰島素嘅水平先會上升。呢你要留意啦，係當血糖水平上升到最高一陣之後，胰島素嘅水平先上到最高峰，然後啦，當血糖水平下降到就係跌到最低啦。隔一陣先去到胰島素嘅水平跌到最低，咁所以啦，你要畫嘅咧就係一條大約咁樣嘅曲線。咁你會發現啦，咦，梁 Sir 特登點解呢度咧有個上上落落嘅？就係我想話俾大家聽，胰島素嘅分泌或者高糖素嘅分泌唔係有與冇嘅問題，佢邊有咁巴閉啊？一落到去即刻走去平線啦，係咪？係唔現實嘅，都俾咗少少嘅緩衝區，大家跌少少，跟住升翻少少。跌少少，跟住升翻少少，咁係最緊要你要保持翻呢個基礎嘅水平啦。1、2、3、4。而之前咧，梁 Sir 都拍咗一段片啦，就係用生態系統咧去解釋延時效應嘅。咁你會發現啦，除咗生態學有延時效應咧，原來荷爾蒙嘅分泌對於體內平衡咧都係有一個延時效應嘅。跟住啦，就去到拍攝啦，就要我哋去解釋下點解 糖尿病患者咧係適宜進食低嘅升糖指數嘅膳食嘅。咁當中啦，要考我哋嘅咧就係全視技能啦，比較下呢兩條曲線嘅頂峰究竟有咩特別啦。咁我哋會留意得到咧，當一個健康嘅人啊佢進食咗高嘅升糖指數嘅時候，相比起食一個低嘅升糖指數嘅膳食嘅時候咧，咁佢嘅血糖水平咧係升得零舍高嘅。而家我哋講緊嘅咧係一個健康嘅人佢所面對嘅情況。如果而家係一個糖尿病患者，究竟佢有啲咩嘅病徵呢？最簡單嘅概念就係佢係冇能力去控制血糖嘅水平，無論佢係唔能夠產生胰島素嘅糖尿病一型，又或者佢嘅身體細胞唔能夠對於胰島素作出反應嘅糖尿病二型，其實佢嘅血糖水平都會比一般人係為之高，尤其是係食咗餐飯之後。而佢另一個病徵就係尿液入面係有葡萄糖嘅出現。根據呢兩個概念咧，第一樣嘢要提大家嘅就係你唔好花時間走去辨別究竟呢個糖尿病患者佢係一型定係二型，根本就唔重要。重要嘅係佢有啲咩嘅病徵。第一，食完餐飯之後血糖會零舍高。第二，尿液入面有葡萄糖嘅出現。所以你成個思考邏輯就係要比較下，當一個糖尿病患者佢進食高升糖指數，又或者低升糖指數嘅話，比較下佢哋嗰個血糖水平嘅高峰究竟係點樣轉變啦。而由於今次佢係糖尿病患者，我哋就梗係要諗辦法令到呢個糖尿病患者係唔會面對一個咁嚴重嘅病徵。咩叫嚴重嘅病徵啊？就係血糖唔好升得咁高啦，喺尿入面唔會排放咁多嘅糖出嚟啦。咁所以啦，你要諗得出嘅就係呢個低升糖指數嘅膳食有乜嘢重要性？佢點解要食呢一樣嘢？背後一定係要有好處噶嘛。如果冇好處嘅，點解我要食佢啊？係咪？所以啦，低升糖指數嘅膳食咧，係會導致到呢個病人嘅血糖波幅咧係冇咁大嘅，係一個少一啲嘅波幅。而個好處就係講緊佢嘅血糖水平唔會升得咁高，一個極高血糖嘅機會咧就會減低咗。唔代表佢嘅血糖唔會上升，因為正常人都會上升，只係對於個糖尿病患者，佢冇能力承受一個咁高嘅上升，所以退而求其次，唔該食一個低升糖指數嘅膳食啦。好，跟住啦，又嚟到一點出發啦。今次咧題目就問我哋升糖指數，然後伸延出嚟嘅就係血糖嘅調控啦，同埋營養作用嘅。血糖嘅調控唔難理解啦，激素嘅協調啦，當中有胰島素啦、高糖素啦。亦都考緊我哋有關於體內平衡嘅概念啦，亦都有負反饋啦，所以先會提翻大家啦。我哋嘅胰島素或者高糖素都係將個血糖水平去調控翻去正常水平嘅，又或者我哋講嘅 relatively constant， 一個相對上一致一樣嘅水平。呢一樣嘢你一定要明白嘅。跟住啦，就問營養作用啦。五大個步驟：進食啦、消化啦、吸收啦、同化啦，同埋排位嘅。咁呢五個步驟咧，大家一定要識噶啦。無論係 MC 啦，定係長題啦，佢都可以去問你嘅。咁過往都有類似嘅題目，快手睇翻啲片溫下書啦。今次嘅題目咧，主要就係有關於消化同埋吸收。消化有分兩部分，一個係機械式消化，另一款係化學式消化。邊一款係有酶嘅參與呢？就係第二款化學式消化啦。今次佢冇考你咁多嘢嘅，但係最基本你要知道，我哋將款嘢食消化就係將佢由大粒複雜變成細粒同埋簡單同埋溶得到嘅一個分子結構。咁所以啦，消化嘅重要性就係幫助我哋去吸收。咁所以兩者嘅關係係非常之密切嘅。過往咧都有小腸啊消化嘅題目咧都拍過片嘅，大家又係要快手睇下嚟溫書咯噃。去到最後尾咧，我哋就將體內平衡反轉嚟問你，就係體內不平衡，亦即係體病學BIO啦。當一個人佢係冇能力去控制血糖水平嘅話，自不然就係患有糖尿病啦。咁糖尿病患者嘅生活模式 又有咩咁特別呢？原來佢係要進食一啲低升糖指數嘅膳食嘅。原因何在呢？而當中咧，亦都考翻大家延時效應嘅。218 question 7 is about glycemic index. It is an indication of the effect of the food on the blood glucose level. The higher the GI value of a food, the quicker is the rise in the blood glucose level. In this graph, it shows the changes in the blood glucose level of a healthy individual after consuming the same quantity of a low GI meal or a high GI meal over a period of 3 hours. For part A, it is a very straightforward question. Describe how the consumption of a meal lead to an increase in the blood glucose level. The question type is description, and we need to recall the mechanism of carbohydrates digestion and absorption, and we need to relate the mechanism to the rise of the blood glucose level. Therefore, we just need to focus on the rise of the glucose level after consuming the high GI meal and the low GI meal. And in these two paragraphs, I would like to talk about the concept about the digestion and the absorption. Do we need to digest all the food we intake? Not really. We just need to digest the large, complex, and insoluble food. For example, the starch, most proteins, and the lipids. Since the wall of the alimentary canal is differentially permeable, therefore, the food substance, they must be small, simple, and soluble, and then they can pass through the wall of the alimentary canal and enter the blood. The whole process of breaking down the food into small molecules is called digestion. And after the food is fully digested into small, simple, and soluble substance, so it can be absorbed into the circulatory system through the wall of the alimentary canal. And which part of the alimentary canal it is? It should be the ileum, one part of the small intestine. And then the food will be absorbed into the blood. So the critical concept we need to recall is the basic unit of the complex carbohydrates. For example, the starch is made up of glucose molecules, and for the disaccharide, maltose, sucrose, lactose, they also contain glucose. And then we talk about the absorption. We call the location where absorption takes place. And we need to realize the digested food is absorbed to the blood. Therefore, in the answer, we need to talk about the digestion of the food containing carbohydrates to form glucose. And then the absorption of the glucose from the small intestine, which is the ileum, the food will be absorbed into the blood. So any possible question variation of part A, it can ask you to describe how the consumption of a meal lead to the change in the blood glucose level. So you can see the mark allocation from 2 marks to 3 marks because there is 1 extra mark for the change in the blood glucose level. You need to recall the graph. So you need to take a look at the graph to see that there is an increase of the blood glucose level and then describe how the consumption of the meal lead to the rise of the blood glucose level. And the second variation is about the explain. We change the question type from description to explanation. We need to explain the change in the blood glucose level after the consumption of the meal. So you can see that actually they are asking the same idea, same concept, just change the question type. The changes, the first mark is still need to recall the increase of the blood glucose level. We need to talk about the digestion of the carbohydrates and talk about the absorption of the glucose. And for part B, let's take a look at these 3 questions. Part 1, name the key hormone which lower the blood glucose level. Part 2, describe how this hormone lowers the blood glucose level. For part 3, on the graph, sketch a curve to show the change in the level of this key hormone in response to the consumption of high GI meal by the healthy person. So for part 1, it checks us the concept that to distinguish from the function of the insulin from that of the glucagon. So we can see that from the graph, after having such high GI and low GI meal, the blood glucose level increases and then the blood glucose level decreases. and is asking, name the key hormone which lowers the blood glucose level. So from the textbook, we can see that the overall effect of the insulin is to decrease the blood glucose level. So that's why the answer of part 1 is insulin. And for part 2, describe the insulin. How does it lower the blood glucose level? So we need to recall the mechanism of blood glucose regulation by insulin. So you can also check the very straightforward concept from the textbook. I would like to remind you the action verb. Stimulate, increases, enhance, or promote. So for this action verb, they are crucial. Stimulates the body cells and liver cells to take up more glucose from the blood is the very fundamental way to lower the blood glucose level. But if we store the glucose in the cell, it's not favorable because it will affect the water potential of the cell. So we need to consume them. So that's why we need to increase or promote the respiration in body cells to consume the glucose. And for the last way, after consumption, we can store them to make it into insoluble form, glycogen. Because the glycogen, they are water insoluble, so it will not affect the water potential of the body cells. We can promote or enhance the conversion of glucose to glycogen by the liver or muscle cells. And there is a reminder for you all. According to the negative feedback mechanism, we described that the insulin lowers the blood glucose level back to the normal level. It's the comprehensive idea of the negative feedback to restore something back to the normal level. On the other hand, the glucagon increases the blood glucose level back to the normal level. So you can take a look at this video about the homeostasis. How can you do the scaffolding to answer the homeostasis question to get the full mark? And for the part 3, we need to realize the lagging effect of the hormonal control. As we know that the hormonal control is not that immediately compared with the nervous control. Meanwhile, we also need to mention the basal value of the hormones. Because for the hormones, we need to recall the biology philosophy. It is not the matter of yes or no. It's the matter of more or less, as what I mentioned before. So we really need to understand that the insulin secretion is not due to the increased blood glucose level. The concept should be that more insulin will be secreted when the blood glucose level is higher than the normal level. Is more or less concept. So you need the basal value, but not set it to the 0 level. And then the next concept about the curve is that then you need to identify which factor it comes first, or both of the factors, they come at the same time. So for the blood glucose level increases and the insulin secretion, do they come at the same time? Or it should be the blood glucose level increases first and then it will stimulate our body to secrete more insulin. It should be the lagging effect. When you sketch the curve, you need to be ensured that the blood glucose level reaches the peak first, and then the peak of the insulin level, it will come later. So that's the insulin level. So that's the peak of the insulin level. It is lagging behind the peak of the blood glucose level. When the blood glucose level drops to the lower level, and then you see the lower level of the insulin secretion. So it is the shape of the curve. Then you can also find that not only the ecosystem philosophy, but also for the hormonal control philosophy, we can encounter the lagging effect, time lagging. And for part C, we need to explain why diabetic patients should consume low GI meal. This question checks us the synaptic skills. We need to compare the peak of different curves. So you can see that the peak of the blood glucose level caused by the high GI meal is higher than that caused by low GI meal. And you can see that this curve, it shows a healthy individual after consuming the same quantity of low GI or high GI meal, and then we observe the changes in the blood glucose level. That's the blood glucose level of a healthy individual. But now we are talking about the diabetic patient. So we need to recall the sign of the diabetes. The basic idea is that when there is a lack of the insulin, type 1 diabetes, or when the body cells do not respond to the insulin, type 2 diabetes, the blood glucose level becomes very high, especially after a meal. And the second sign is that the glucose will appear in the urine. And there is one reminder for you all, it is the common mistake. So you should not refer to the impaired glucose control and then to try to analyze that type 1 or type 2 diabetes. No matter the diabetic patient, they are type 1 or type 2, doesn't affect the sign. They will still experience the high blood glucose level. And in their urine, there are still glucose present, right? It is not necessary to spend time on comparing type 1 and type 2 diabetes. And the thinking logic is that by comparing the peak of the blood glucose level caused by the high GI meal and low GI meal, we can determine which type of meal will not cause severe sign of the diabetes. In other words, we need to find the benefit of consuming the low GI meal. It's because that if we do not get benefit from the low GI meal, why do we need to eat it, right? So the low GI meal will lead to small fluctuation in the blood glucose level because you can see that the peak is lower than that caused by the high GI meal. And then the chance of having too high blood glucose level or the glucose appearing in the urine will be lower. So that's the benefit of consuming the low GI meal. And let's talk about the curriculum mapping. This question starts from the glycemic index and it asks about the blood glucose regulation and the nutrition. So for the blood glucose regulation, we talk about the hormonal coordination and mention the insulin and glucagon. And for the blood glucose regulation, it's about the homeostasis. And then we need to recall the negative feedback mechanism. For the nutrition, there are 5 main processes: ingestion, digestion, absorption, assimilation, and ejection. There are a lot of questions, no matter MC or long question, ask you these 5 main processes. So do revision, please. And for this question, it focuses on the digestion and the absorption. We need to do some revision about the digestion, mechanical digestion, chemical digestion. Especially in this question, we are talking about the digestion of the starch or the compressed carbohydrate into glucose. So we digest the food from large, compressed, insoluble into small, simple, and soluble molecules. So we need the chemical digestion, which involve enzymes. And what is the importance of the digestion? It helps us to absorb the food because if the food, they are large, they are compressed, they cannot be absorbed. So we need to break it down first. And then so you can check the video about the digestive system, no matter long question or MC. And then we combine the homeostasis concept, and the blood glucose regulation concept. We can do the disease approach and learn something about the diabetes. And from this question, we know that they should consume the low GI value meal. What's the reason behind that? What's the benefit behind that? You need to know it. And we also talk about the lagging effect of the hormonal control. And we also mention the lagging effect of the hormonal coordination.